With the current spike in COVID cases in China in millions, everybody is worried, including India. And everybody think that can we be affected? There is a very good saying that till neighbors are at peace, you cannot be peaceful. We have been suffering from this COVID pandemic for last 3 years, and we thought that we'll have a respite. But China situation orchestrated by BF.7, which is also a descendant of Omicron variant, is creating havoc. Till now, China was hiding, so we didn't know what was hiding inside, what is being done inside. They have faltered with two things. Number one, the zero COVID policy, which is false. It cannot be implemented because COVID has come to infect all of us. There is a saying that 90% of us are infected and 10% do not know or they are telling lies. With this, if China locked down the entire China for years, they are bound to suffer as soon as they open, and therefore they are getting infected. But India has got BA.2 and BA.3 to some extent, and there is a recombinant of BA.2.10 and BA.2.75, and that is called XBB, and that is almost 70% of total infections in India are XBB. But we have very few cases of BA.7. First case was noticed in July 2022, and thereafter another 4 or 5 cases, Odisha and Gujarat. But that is not going to worry us because BA.4 and BA.5 has never been in India in a large number. And all these are current variants which are BF.7 in China and in the neighboring countries like Japan, South Korea, Taiwan, Hong Kong, and BQ.1 and BQ.1.1 in USA, Brazil and some European countries. They are both descendants of BA.5, and it is like a territorial authority that if one's territory is taken over by BA.2, BA.5 cannot enter, and that's the reason that we did not get BA.4 and 5. So largely speaking, we will not be affected. But sometimes what happens in an area or in a country or in a community where they are not infected earlier and they are not been vaccinated properly or their vaccines are poor, then they can have other variants and subvariants coming. And if other new variant comes which is more severe than Delta or equal to Delta, then that can enter India or any other country. And therefore we have to keep our fingers crossed. Secondly, the issue has been, will this spike be, if at all the spike comes, will this spike be like a Delta? I do not think it will be like Delta. But Delta was a different virus. It was, the virus was same, COVID, but it was a different variant. It was mainly affecting lower respiratory tract, and Omicron affects upper respiratory tract. In that, Delta used to give 5 times more infections, 10 times more hospitalization and 10 times more death, and therefore Delta was different and we will not have anything like Delta. Now the question comes, should China be held accountable? All over the world people have been saying that China should be held accountable. Yes, it should be, but that is just a ego satisfaction. We are not going to gain anything out of putting somebody responsible. For example, the original virus came from Wuhan in China. Thereafter, Alpha was from UK. We cannot hold UK responsible. Thereafter, Delta has been from India, and that spread to almost 150 countries in 2 to 3 months. India cannot be held responsible. Omicron was originated from South Africa. Now all over the world Omicron is going on. We cannot hold South Africa responsible. But the origin, from where it could have come, was it a part of biological warfare? Was it an accident? That has to be investigated, and that job is to be done by intergovernmental agency which should be neutral, like WHO, World Health Organization. And they have appointed 3 to 4 committees, and yet the committee's reports have not come out. So probably once the report come out, we'll know how the virus came out, how the virus manufactured, whether it was accident, whether it was man-made. And then only we'll come to know whether it was exploded from a particular lab, by what manner. However, one of the scientists from the same lab said that this virus was being manipulated in our lab, and there has been some kind of grant from NIH from USA. So these two big nations are involved, and we are a small nation in comparison to them. Let them decide, let WHO decide. But currently what government is doing is fine, because if there is a fire in our neighborhood, we need to take precaution. At the same time, I would like to warn people that you can take precaution, but there is no need to panic. You can have your livelihood, you can have your business, you can have your travel and leisure, but whenever you are exposed to huge crowd, use mask. And mask will prevent you from not only COVID, but also flu or RSV, which is a respiratory syncytial virus, or there are a lot of common cold during the winter season. So that will protect you from several respiratory tract infections. Use masks. There is no harm in using masks. Get vaccinated if you have not been, and take a booster dose, because almost 25% have taken booster dose in India, which are eligible. 75% have not taken. And now there is a new vaccine being made available, which is a nasal, intranasal vaccine, and that is very simple. 4 drops in both the nostrils, and there is no need of injection. It can give immunity to you from getting infection, and it can give immunity to others, because it is the only bilateral vaccine that you do not get infected, and if you are infected, you do not pass on the infection to others. And the simple logic is that the vaccine which put in the nose, that gives you intranasal or mucosal immunity, in addition to IgG immunity, IgA immunity, and T cell immunity. So it gives a better immunity than the injectable virus.